Next up, it's always a pleasure in talking to one of the major medical societies. As you know, there's over 100 medical societies in America. There's 37 major medical societies. And one of the most prestigious in America, really in the world, is the American College of Cardiology. And it's always a pleasure and an honor to have someone with an esteemed background like Dr. Bhatt to join us here today. And she's got a presentation for us to really help us dig further into this digital health reset. And as we heard from Dr. Kutana yesterday from Columbia Medical Center, and we heard a little bit more about what is happening with digital and cardiovascular care in some of the invasive side. We're going to hear now today from Dr. Bhatt about how entrepreneurs and investors and innovators are able to partner with clinicians. And that's a very, very important process, given the just the amount of strain on the clinician community today in the United States post-COVID and just what they're managing. And so really appreciate you joining us here today. Ami, thank you for joining us, and handing the virtual podium over to you for your presentation.
Great. Thanks so much, Stan. Great to be here. Sorry for the awkward lighting. I'm trying a new office, and it's clearly not working for Zoom just yet, but we'll figure it out. But you'll be looking at my screen more than me, hopefully, so that'll be good. Stan, will you just give me a verbal okay if I am in presentation mode successfully?
Yep, you're in presentation mode, and you're coming in loud and clear.
Fabulous. All right, I'm going to just get this little control thing out of the way. Okay. Traversing the last mile. Let's get to it. One of the hardest things that we talk about, as we've all been talking, is you can make great technologies. You can invest in fantastic companies, and 19 out of 20 are just going to die at that last mile and never actually make it to where the clinician and the patient interact. And so that is part of our mission, is to be successful at getting all this great work to the place where it matters the most. Make sure I can forward. Great. So how entrepreneurs, investors, and innovators can partner with clinicians to deliver high quality care in the community. And we'll talk about 4 things today. I'll go through pretty quickly just the new cardiovascular practice landscape, talk a little bit about how you can partner with us, because that often comes up in the chat. And so now I just put it in and deal with it head on. Talk about keys to the kingdom, what gets adopted. And then I'm going to mention 3 technologies that I think are going to revolutionize the cardiovascular field that you might find interesting. So our cardiovascular landscape now post-COVID is different than it was before. We have more asynchronous communication, so patient-reported outcomes, electronic consultations, communicating with your clinical team through the electronic health record. We have blended care. Every practice does it differently. Some people do more in person, some people do more virtual, some offer care at home, and it really depends on who the system is, who the clinicians are, and what the patients prefer. But we're seeing blended care throughout the country and the globe. Clinical remote monitoring is something we were excellent at with medical grade devices, but we're now adding digital tracking and wearables to how we measure your cardiovascular health, and we are testing that and researching it. And then lastly, and most important, and we'll focus on this a little bit today, is data and artificial intelligence, or as we like to call it, collaborative intelligence. The idea that there is just too much information out there for a single clinician to be able to know everything that is possible about you during the 20 minutes you spend together. And so how do we optimize the massive body of knowledge out there with the actual interaction between a clinical team and a patient? And that's where data and artificial intelligence come. So one thing to think about as we kind of level set, thinking about the past day in person, today and tomorrow virtually, is what are we looking at, right? We're actually looking at population health. When we talk about innovating, when we talk about the future, we are not just talking about the tertiary care and the most complex care. We are talking about the most complex care that in fact is sometimes the simplest disease, but the hardest to get a hold of. And that's chronic disease management. That's the base of this pyramid. And we really think that if we use a good digital health strategy, we can partner with patients in their care while allowing them to remain local. And that's incredibly important for patients to be engaged and to stay in their community and still be able to do what's needed of them. However, if we are managing them chronically rather than episodically. If I see you twice a year and I say, hey, your blood pressure looks good or high, I'm really missing the majority of your life and your blood pressure. So if I can continuously monitor you, I can then catch you when you are rising risk. Now I can identify potential progression of illness. I can address it promptly, bring it back down into the chronic management realm. Or if you require intervention, I can get you to the right next test, the right clinical team, the right location of care. This is what we're trying to do when we're all talking about what is our digital health strategy. And this goes for cardiology, but actually, really every field. How are we going to do that? We're not going to do that as clinicians alone. We're going to actually need to partner in order to create sustainable, in my case, cardiovascular healthcare, right? So the first is co-develop your solutions with clinical entities or bodies like societies who can help you think about what is that market, what is the fit, what is the fit in the workflow that is happening at the level of interaction, and how are you going to be successful at being adopted? Plan that from the very beginning along with your actual technology. The next is we are working on technical frameworks. So that way we can give some guidance to you. We partner with the Consumer Technology Association to say, if you're going to create a cardiovascular technology, here are the things that we really need from you for this to be successful. We have a job to our members as well. We have 56,000 members globally. And our job is application guidance. If you're making a great technology, or you're investing in a great technology, and our guys can't figure out how to use it, that's going to be another hurdle. And so one of our jobs as the American College of Cardiology Innovation Program is, can we teach our members how we use these applications and where they fit in? And then a lot of thought leadership, like what we're all doing here today. And lastly, there just needs to be financial investment. We need to align the financial investment with what's actually going to cross the finish line. And we need to have those relationships to be able to make that happen. I'll give you a couple examples of things that we actually do, because oftentimes we talk and we say, well, we help people understand. Here's how we do it. This is a telehealth workbook. We have the same for point of care ultrasound, remote patient monitoring, and care at home. These actually tell you if you have a clinical practice and you want to use telemedicine, this is what you need technologically. This is what you need to know. This is what an admin answering the phone needs to say to help your patients understand what this new system is. And so we really go through the details and do that for all the different arenas that we co-develop it. We talked about the Consumer Technology Association, great group to partner with. And then lastly, we are doing this globally. So those who have not looked at the World Heart Federation roadmap for digital health and cardiology, it is great. It has real examples from throughout the globe of what people have done and where they've been successful and where their hurdles have been in implementing digital health. And so a really nice document that's free to everybody online. I'm going to highlight a couple companies here, but mostly for the sake of an example. When we think about clinical adoption, there are three things we think need to happen. So one is we really emphasize convening, bringing public and private partners together to drive digital transformation together. The group we run is called the Applied Health Innovation Consortium. It meets every October. HITLAB is a great group that we're really excited to be part of. There's Dime, there's AI Med, there's so many great places. Health and Vive have been excellent the past year. A real important emphasis is that we cannot have clinical silos running next to technology, running next to innovation, large companies running next to VC. If we keep doing it that way, we're not successful. So the crossing over is really important. We appreciate HITLAB for that. Co-development, we actually, as a society, will co-develop tech solutions. OSOVR is one of those companies we just announced. I'll tell you more about that in a second. And then lastly, really collaborating. So thinking about education, thinking about care delivery, equity. And if you haven't looked at the company called FoodSmart, it's worth taking a look. It's food as prescription medicine, because there is a lot in the public health arena that we need to pay attention to as we are in the digital health arena as well. So what are our barriers? Misaligned training. We're not ready. We haven't trained anybody to do this yet. There are a lot of great groups who've created mechanisms to help train clinicians, systems, and patients in how to do this. And so we're really moving towards what that looks like now. Workflow integration is key. If there was one thing I want you to walk away with, it's please think about workflow integration when you're making your new technology. We are working on payment models and always paying attention to the digital divide. What are the opportunities? We know that this leads to better quality care in the communities where people live, that is continuous rather than episodic, lead to better quality care. Carry that with you and with your company as you're moving forward. We can improve health equity as long as we have the intent to improve health equity. Clinician well-being will get better. We have a clinician burnout problem, and one of the key issues is a lot of the administrative burnout. And I've seen many of you who've been here and who've been joining are ones who are focused on that back end and helping the administrative burden be less, so the time between patients and clinicians can be more. And that really does improve access as well. So here, last 3 slides, and then maybe we'll have time for questions. First, what gets adopted? So if you can stem the rising burden of disease, cardiovascular disease, you're in. Okay, so that's one of the more of the biologic physiologic technologies, but that's a big one. Cardiovascular care in the community. What is being adopted are the things that do not need patients and families to mobilize to all come in, but rather enable us to go out. Okay, very important. Patient agency, not just education. Patient agency, helping patients be part of the solution to their own disease. That's really important. It's different than just patient literacy or patient education. You need the other two to get to agency, but really agency is what we're looking for. Please increase the value of the electronic health records in whichever way you can. Help us optimize clinical workflows. We know they are not optimal. If you are creating standardized data, transparent systems, we will be more likely to adopt you than if we don't understand, or if you're not using the same language as everybody else. If you can sell a C-suite on operational sustainability, not this is a pilot and if it works, you can consider, but here, if you do this, we can show you that it will sustain, both in terms of outcomes and patient experience, ideally in terms of clinician well-being, and most certainly in terms of cost efficiency. So sustainability, show it up front. And one way to do that, and probably the best way right now, is optimizing resource utilization. We have really disparate resource utilization in various areas of this country and the globe. And so optimizing that in any small way that you can is one of the best ways to show that you're sustainable and can really optimize our workflows as well. So I think these are the areas that I'd emphasize and see if you and your company or the things you're investing in fit anywhere in here.
That's really helpful. I think the nice thing about this is really that what you've done is lay down the trail if you can. And for a lot of folks who are listening, that's what they need. They just need a pathway. And the fact that it's obvious that you've done this a lot, you know what you're talking about, and you've talked to a lot of people who've done it, and you've really put together a nice guideline for folks to follow. And that's tremendous. Thank you very much.
Absolutely.
For joining us today. And
thanks for having me. I'm gonna close with this slide so that people can see it. These are the 3 areas: collaborative intelligence, virtual reality, and digital modeling. I think this is where we're going to go. It sounds futuristic, but I think these are the 3 things I keep my eye out for, because they're going to really change how we practice.
Thank you very much.